Good morning, this is Dr. Katsuura in Novato, California, and thanks so much for uploading your MRI. We're just going to go through it in a detailed fashion now, and afterwards, if you have further questions, you can feel free to schedule an online consultation or come in and see me in person if you're nearby. So this is your lumbar MRI, and we have two different images here. This one is a cross-section looking at the sagittal plane, and this is an axial, meaning that we're looking at your cross-section from side to side. As you can see here, you can see the lumbar vertebrae. This is the L5 vertebrae, L4, L3, L2, L1, and you have 5 lumbar vertebrae in total. This is the back of the spine, and this is the front of the spine, and your head would be up in this direction, your legs in this direction. So as we can see here, we see the discs, which are these black structures, and also these square-shaped structures, which are the vertebral bodies or the bones. And inside this white area here is the spinal canal, and these gray structures are the nerves that run down the spinal canal. This is the L4 vertebrae, and this is the L5 vertebrae. We can see that there is a slight issue here with this vertebrae being slipped forward on the 5 vertebrae. That's called a spondylolisthesis when that occurs, and you can see that it results in this narrowing or this pinching in this area right here where the nerves that are running down are actually getting trapped in that area. And so that can be very painful and can also result in numbness and weakness of the lower extremities, the legs. On this view, this is the axial view. So this is looking at a horizontal cross-section through your body. And we can see this is the front of the body here, and this is the back here. And this is the area of concern right here. That is the vertebra, and inside here is the spinal canal. So let's just go up on your scan, and you can see up here at the this is the L3-4 level, you have a nice wide open spinal canal. However, if we scroll down to the L4-5 level, you can see that the spinal canal has become quite diminished, and it's actually very tight at this area. And that's a condition known as spinal stenosis. So you can see on both views here that the spinal canal has become very narrowed in this area, and all the nerves have become pinched at that area. So these two conditions known together is called degenerative lumbospondylolisthesis with spinal stenosis. So this is a condition that typically requires surgery to treat. The physical therapy, epidural steroid injections, non-steroidal anti-inflammatories, other medications will not treat this problem. The reason is that this is a mechanical problem. There's mechanical compression of the nerves, and there's also this spinal malalignment where the discs are no longer on top of one another. And so medicines frequently fail in treating this problem. The way I explain it to my patients is that if you have a rotten foundation in your house, you call the general contractor and say, hey, can you realign my house, but just do it with a new fresh coat of paint. They won't be able to help you. What they really need to do is get underneath the house, put new beams in, and fix everything up so it's back the way it should be. And that's essentially what I recommend for these types of problems. And there's two main options. One, you can have a decompression alone, where the spine surgeon will actually go in and clean out some of this stuff in the spinal canal that has become really thickened and hypertrophied, and you can check out some of my videos online to understand how that's done. Or we might actually go in and perform a spinal fusion where we put in a new artificial spacer in between the two vertebrae. This helps put this bone back where it should be in alignment with the L5, and then decreases the stenosis, and we hook all these together with rods and screws. That's called a spinal fusion. So those are just some options to consider. I'd love to chat with you more further about this. If you have any questions, feel free to reach out, or either by text or email. Thanks.